Could you spot the warning signs of a silent killer before it's too late? Imagine this. Your mom, dad, or grandparent is sitting at the dinner table, chatting like normal, when suddenly their speech slurs or they can't quite move their hand. It's subtle, almost too subtle to notice. But what if that fleeting moment was the only chance you had to save their life? Hi there, and welcome to today's video, where we're diving deep into 8 often overlooked signs of mini strokes, those sneaky little medical emergencies that can strike without warning. Now you might be thinking, it can't happen to my loved ones. But here's the shocking reality. Mini strokes, also called transient ischemic attacks, happen to hundreds of thousands of people every year, and the elderly are especially vulnerable. What's scarier? Up to 40% of those who experience a mini stroke go on to have a full-blown stroke within a year. This is not just another health video, it's a potential lifesaver. Knowing the subtle signs of a mini stroke could mean the difference between acting quickly or missing a critical window to prevent permanent damage or worse. So, what are these signs? They're often so small and quick that they're dismissed as fatigue, clumsiness, or just getting older. But trust us, brushing them off could be a dangerous mistake. We're about to break down the 8 must-know symptoms in a way that's easy to understand, so you'll feel empowered to take action if you ever see them. Whether it's you, your parents, or your grandparents, this information could genuinely save a life. And here's the kicker. Transient ischemic attacks don't just stop at one warning. They're like nature's fire alarm, signaling that something bigger could be on the way. Are you ready to recognize the warning signs and be a hero for your loved ones? Stick around because we'll not only walk through the symptoms, but also share exactly what to do if you suspect someone is having a mini stroke. These 8 clues aren't just medical trivia, they're life-saving knowledge. Now, let's jump in and uncover these subtle, life-saving signs that you can't afford to miss. Number 1. Sudden weakness or numbness. Sudden weakness or numbness, particularly on one side of the body, is a hallmark sign of a mini stroke or transient ischemic attack. But why does this happen? It's all about blood flow, or the lack of it to be more accurate. A mini stroke occurs when there is a temporary blockage in a blood vessel that reduces blood supply to specific regions of the brain. For instance, if the middle cerebral artery, which supplies the motor cortex, is affected, the brain struggles to send signals to the muscles on one side of the body. This results in weakness or numbness that feels as if someone just pulled the plug on the arm or leg on the affected side. This phenomenon, although fleeting, is a warning that something bigger as a full-blown stroke might just be lurking around the corner. Back in 2018, a study published in the Journal of Neurology, Neurosurgery, and Psychiatry investigated the link between transient ischemic attacks and early stroke intervention. Researchers at the University of Oxford studied 1,278 patients who reported transient ischemic attack symptoms, including sudden numbness or weakness. Their method involved a rapid-access transient ischemic attack clinic where patients were evaluated, treated, and followed up rigorously. Their findings show that 56% of patients experiencing these motor symptoms had blockages in key brain arteries detectable via imaging, and 12% of them had a subsequent major stroke within just 90 days. The study emphasized that early identification and treatment of these mini strokes reduced the risk of major strokes by 80% thanks to quick interventions like blood thinners and lifestyle modifications. So while that sudden loss of feeling in your hand or leg might seem like a passing inconvenience, it's your body screaming for help. Acting on it, whether it's rushing to the ER or urging your loved one to see a doctor, could be the difference between a close call and a life-altering event. Number 2. Temporary vision changes. Temporary vision changes, such as blurred vision, double vision, or even sudden loss of sight in one or both eyes, can be a major red flag for a mini stroke because they're often caused by reduced blood flow to the optic nerve or areas of the brain responsible for processing vision. The optic nerve is a nerve attached to the retina of the eye that transmits signals from the eye to the brain. Temporary vision changes occur when a small clot temporarily blocks a blood vessel, disrupting the oxygen supply to these critical areas. Think of it like a temporary blackout in your home where something is briefly blocking the power. A 2019 study published in the journal Neurology, conducted at the Mayo Clinic, examined 1,000 elderly individuals who reported temporary vision disturbances. Researchers used imaging techniques like MRI and Doppler ultrasound to pinpoint blood flow disruptions. Shockingly, 25% of these patients were found to have experienced a transient ischemic attack, and within a year, 30% of those went on to suffer a full-blown stroke. The study showed that even short-lived vision issues should never be brushed off as just aging or eye strain. Instead, they're nature's way of waving a bright red flag that something's wrong with the brain's plumbing. Identifying these early clues can help doctors step in, prescribe blood thinners, or recommend lifestyle changes that reduce stroke risk. In short, if someone starts seeing a double image out of nowhere, it's not just an optical illusion. It could be a lifesaver waiting to happen. Number 3. Difficulty speaking or understanding speech. Difficulty speaking or understanding speech, also known as aphasia or dysphagia in the medical field, is one of the most telltale signs of a mini-stroke, and here's why. As we explained earlier, mini-strokes occur when blood flow to a specific part of the brain is temporarily blocked. When this blockage impacts the left hemisphere of the brain, specifically an area known as the Broca's area, which is responsible for speech production, or Wernicke's area, which is critical for understanding language, communication abilities are disrupted. Imagine your brain as a high-speed internet connection. During a transient ischemic attack, it's like a brief Wi-Fi outage. The signals that allow us to form and process words get delayed or lost. This disruption is temporary, but acts as a fire alarm, signaling potential major strokes ahead. In 2016, a pivotal study published in the Journal of Neurology, Neurosurgery, and Psychiatry provided strong evidence linking speech difficulties to mini-strokes. Researchers at the University of Oxford studied 1,000 transient ischemic attack patients over 3 years, analyzing their presenting symptoms and outcomes. The results were eye-opening indeed. It was reported that 35% of participants experienced sudden difficulty speaking or understanding words during their transient ischemic attack episodes. Among them, 45% experienced a full-blown stroke within the following 90 days, with the majority occurring within just 48 hours of the transient ischemic attack. These findings underscore how crucial it is to recognize speech issues as red flags. Intervening immediately could be life-saving. The study involved detailed patient interviews, MRI scans, and neurovascular imaging to confirm that even fleeting speech problems indicated blood flow disturbances in critical language regions of the brain. What's amazing is that these disruptions can reverse themselves completely within minutes or hours, leaving no trace. This makes it easy to dismiss them. But trust us, they're anything but harmless. Recognizing these symptoms could buy precious time to prevent a more devastating stroke, thanks to rapid treatments like anticoagulants or lifestyle changes. So, if you or a loved one suddenly find yourself grasping for words or unable to understand what someone's saying, don't brush it off as just a senior moment. It's your brain's way of flashing a big neon sign. Get help now. Number 4. Sudden dizziness or loss of balance. Sudden dizziness or loss of balance during a mini-stroke is like your brain's way of crying out, "Help, I'm not getting enough blood." When there's a temporary blockage of the blood supply in the parts of the brain responsible for balance and coordination, such as the cerebellum or brainstem, it can result in a momentary disruption of your equilibrium. Think of it as the brain's balance system glitching because it's running low on oxygen and nutrients. Without these, even a small interruption can throw your sense of stability completely off. One study that backs this up was published in Stroke Journal in 2019 by researchers from the University of Oxford. They examined 1,002 patients who experienced mini-strokes, meticulously analyzing their symptoms and outcomes. Here's what they did. The patients were assessed for various neurological symptoms, and their brain scans were reviewed to pinpoint the affected regions. Results showed that 39% of patients with dizziness or balance issues had mini strokes affecting the posterior circulation of the brain, which includes the cerebellum and brainstem. Shockingly, about 20% of those patients went on to have full-blown strokes within 90 days because they didn't seek immediate care. This research highlights why recognizing sudden dizziness as a warning sign is so critical. It's not just getting older or standing up too fast. It's your body telling you something's wrong. A good thing in all of this is that acting on this clue quickly by getting medical attention could stop a future, larger stroke in its tracks. So, if you ever feel like the room is spinning without a cause, don't brush it off. It could be your brain's way of giving you a second chance. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Short-lived confusion or memory lapses. Short-lived confusion or memory lapses during a transient ischemic attack occur because a small clot temporarily blocks blood flow to specific parts of the brain responsible for cognitive functions, such as the temporal or frontal lobes. This brief disruption deprives neurons of oxygen and glucose, impairing their ability to communicate. Think of it as a temporary power outage in your brain's memory bank or thinking hub. Things flicker on and off, leaving you feeling disoriented for a few moments. A 2021 study published in Stroke, the Journal of the American Heart Association, took a deep dive into this phenomenon. Researchers analyzed over 1,000 elderly patients who experienced transient ischemic attacks and found that 31% reported confusion or difficulty recalling recent events as a primary symptom. Here's how they figured it out. The team conducted cognitive assessments before and after the events, tracked MRI scans for changes in blood flow, and compared recovery timelines among participants. They discovered that 80% of those with confusion symptoms regained full clarity within 24 hours, confirming the transient nature of the symptom. However, the study also highlighted a critical warning. In 25% of cases, confusion was the precursor to a full-blown stroke within 3 months. This is why it's so important to recognize confusion as more than just something that comes with age. So, while brief forgetfulness might seem harmless, like misplacing keys or zoning out mid-conversation, it's your brain sending a subtle distress signal. Catching this early could mean preventing a much more serious stroke later. Science isn't just fascinating, it's life-saving. Number 6. Severe headache with no obvious cause. A severe headache that strikes out of nowhere and doesn't seem to have an obvious cause can be more than just a pain. It's a potential red flag for a mini stroke, especially in older adults. Here's the science behind it in detail. The sudden disruption in blood supply because of a transient ischemic attack can trigger intense pressure or pain as the brain's blood vessels react to the reduced oxygen supply. A 2016 study published in Neurology analyzed over 1,200 elderly patients who experienced unexplained headaches. Researchers at the University of Oxford used advanced imaging techniques, like MRI scans, to track subtle blood flow changes in real time. The results showed that around 35% of these headaches were linked to silent transient ischemic attacks, with the majority affecting areas of the brain responsible for processing pain and sensory signals. What is even more fascinating is that 28% of those with headache-related transient ischemic attacks went on to experience a full-blown stroke within 3 months, underlining the urgent need for action. So, if you or a loved one suddenly develops a splitting headache that feels different or off, don't just shrug it off. Consider it nature's emergency siren. It might just save a life. Number 7. Facial drooping. Facial drooping, a classic hallmark of transient ischemic attacks or mini strokes, happens because of a temporary disruption in blood flow to the brain, specifically targeting the facial nerve or the motor cortex responsible for controlling facial muscles. When the blood flow is interrupted, even briefly, the muscles on one side of the face can weaken or become paralyzed. This asymmetry is why one side of the mouth may sag or the eye may appear unable to close properly. But why does this matter so much? Well, a 2019 study published in the Lancet Neurology gives us a fascinating insight. Researchers in the UK tracked over 2,000 patients who experienced mini strokes and found that 36% presented with facial drooping as their first symptom. Here's the kicker. Of those who ignored the symptom, a staggering 45% went on to suffer a major stroke within 90 days. The study's process was meticulous. Participants were monitored over 12 months with detailed imaging and neurological exams to correlate specific symptoms like facial drooping to areas of brain ischemia. Results showed that facial drooping was often linked to blockages in the middle cerebral artery, a critical vessel supplying the motor cortex. Because mini strokes are brief, the drooping often resolves within minutes or hours, which is why it's so easy to dismiss as just a weird twitch. But here's the reality. Acting quickly on this subtle sign can be life-saving. If you or someone you know notices their smile suddenly becoming uneven, or worse, can't smile at all, it's your cue to treat it as an emergency. Catching it early could help prevent permanent damage or even death. Science saving lives, one droop at a time. Number 8. Sudden tingling or pins and needles. Sudden tingling, or the classic pins and needles sensation, might seem like a minor annoyance, something you blame on sleeping in an awkward position or sitting cross-legged too long. But here's the fascinating part. This fleeting sensation can signal a mini stroke or transient ischemic attack. Why? It all comes down to the brain's complex network of neurons and blood supply. When a transient ischemic attack happens, neurons in areas responsible for sensory input don't receive enough oxygen or nutrients, which disrupts their ability to transmit proper signals. This disruption results in the odd, tingling sensation we sometimes feel in the limbs or face. It's like your body's emergency flare. Don't ignore it. A 2020 study published in Stroke, the Journal of the American Heart Association, explored this link in depth. Researchers at the University of Cambridge conducted a large-scale analysis involving over 5,000 patients who reported sensory disturbances like tingling during suspected transient ischemic attacks. They used advanced imaging, including MRI and CT scans, to identify the brain regions affected during these episodes. Their results were eye-opening. 34% of patients with tingling symptoms were found to have a confirmed ischemic event, and among those, 42% went on to experience a full stroke within 90 days if left untreated. What's more, the study emphasized the importance of recognizing silent sensory symptoms, as these are often brushed off as insignificant by both patients and caregivers. By catching this early warning sign and seeking immediate medical attention, you could drastically reduce the risk of permanent brain damage or even death. That's a powerful reason to stay alert to even the tiniest tingles. Who knew such a strange and subtle symptom could carry so much life-saving potential? If you suspect someone is having a mini stroke, time is of the essence. Every minute counts. First, stay calm and assess the situation quickly by using the FAST method. F for face. Ask the person to smile and check if one side of their face droops. For arms, ask them to raise both arms and see if one drifts downward. S for speech. Ask them to repeat a simple sentence and listen for slurred or confused speech. T for time. Know when the symptoms began, as this is crucial for medical treatment. If any of these signs are present, call emergency services immediately. Even if the symptoms seem to go away, keep the person calm and comfortable while you wait, and avoid offering them food, drink, or medication, as this could interfere with treatment. Prompt medical intervention is critical, as the risk of a full stroke can increase significantly within hours of the mini stroke. So these were the top 8 signs of mini strokes in elderly that could save your life. Now we want to hear from you. Which of these signs surprised you the most? Do you recognize any of them in yourself or someone you know? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.